Good morning, Dr. Shashi and class. My topic to be discussed is von Willebrand's disease, also known as factor VIII related antigenic protein deficiency. So introduction, von Willebrand disease is a bleeding disorder characterized by a deficiency or dysfunction of the von Willebrand factor. Its epidemiology is that it is the most common congenital bleeding disorder. So causes of von Willebrand disease. Note there are two types, and this includes the inherited and acquired von Willebrand disease. Inherited is further subdivided into three types, and they are caused by mutations in the von Willebrand factor gene. Type 1 is due to an autosomal dominant inheritance with mild to moderate deficiency of the von Willebrand factor and factor VIII. Type 2 is an autosomal dominant inheritance due to the dysfunctional von Willebrand factor, and type 3 is due to autosomal recessive inheritance with complete absence of von Willebrand factor and factor VIII. Acquired von Willebrand disease is a deficiency that occurs secondary to other medical conditions, and this is caused by diseases due to lymphoproliferative and myeloproliferative diseases such as multiple myeloma, gammopathies, lymphoma, essential thrombocythemia, autoimmune diseases such as systemic lupus erythematosus, cardiovascular defects such as ventricular septal defects in aortic stenosis, as well as side effects of certain drugs such as valproic acid. So the pathophysiology of von Willebrand disease is basically due to the deficiency or dysfunction of the von Willebrand factor, which leads to a dysfunctional platelet adhesion that results in impaired primary hemostasis, or the deficiency or dysfunction of the von Willebrand factor that leads to decreased factor VIII activity, which results in impaired intrinsic pathway of secondary hemostasis. Clinical features, it is often asymptomatic, however, in symptomatic individuals may develop mucocutaneous bleeding, such as ecchymosis, bleeding from gingiva and gums, as well as bleeding after surgical procedures or tooth extraction, GI bleeding, and menorrhagia, which affects up to 92% of women with von Willebrand's disease. Diagnostic would be increased in bleeding time, or as we know it, it is a laboratory examination that tests the function of platelet and their ability to aggregate, as well as a normal or increased prothrombin time that may be prolonged due to factor VIII deficiency. And lastly is the ristocetin cofactor assay, which is a diagnostic test that measures the ability of the von Willebrand factor to agglutinate to platelet, and it will show a failure of platelet aggregation or a ristocetin cofactor level below 30. Treatment is only indicated if symptoms occur. For inherited, more likely to be described a desmopressin, which helps stimulate von Willebrand factor release from endothelial cells, and concentrates containing von Willebrand factor and factor VIII, which is indicated for severe bleeding as prophylaxis for surgical procedures. And if desmopressin treatment is ineffective. Acquired von Willebrand syndrome, you would be prescribed a desmopressin and as well as the treatment of underlying cause. Just a side note, platelet aggregation inhibitors such as aspirin, NSAIDs, and clopidogrel and intramuscular injections are contraindicated in von Willebrand's disease because they further increase the risk of bleeding. And here are my references, and thank you for listening.